Hello friends, I am Dr. Kalpesh Patil, Pediatric and Neonatal Laparoscopic Surgeon, owner of DR.KP'S CHERUBS Child Clinic, Pune. Today we are going to have a brief look on mechanism of descent of testes. It's a very complicated and bit unexplained topic. As a parent, many of the time they don't understand how testis comes down into the scrotum during development. So let's discuss about the descent of testes, what is the mechanism and pathophysiology behind it. Descent of the testes is happening with three phases. One is nephric phase, second transabdominal phase, and third is inguinoscrotal phase. Now what are these three different phases? Till the age of 7 weeks of the gestation, the testes gets developed. In short, we call them as a gonads. So gonads get separated from metanephros. That is called nephric phase. So our genital system is a part of urogenital system in embryology. So it's a urinary system and a genital system which is combined and get bifurcated further during evaluation. So till the 7 week of the gestation, the nephric phase gets completed. Once the nephric phase has been crossed, the gonads gets developed into testes, and till the 12 weeks of gestation, the transabdominal descent happens towards the deep inguinal ring of the inguinal canal. So during this transabdominal descent, many hormonal workup is happening and it is acting. Through this transabdominal phase, the testes will migrate from deep inguinal canal to superficial inguinal canal and towards the scrotum till 30 to 34 weeks of gestation. So almost in 90 to 98% of the babies, till 34 weeks of gestation, both testes are descended into the scrotum completely. Now what are the hormones? There are certain hormones which are secreted in the body during development, such as thyroid hormone, growth hormone, and testosterone hormone. All these hormones are going to act upon the ligament which is attached from base of the scrotum to the lower pole of the testis. Because of the action of these hormones, this ligament is going to get contracted and it will automatically pull both the testes towards the scrotum. Sometimes because of the deficiency of some hormone or incomplete action of the hormone during embryogenesis on the ligament, one of the testes may not migrate down into the scrotum, or it may not come down completely till to the base of the scrotum. So it may remain into the abdominal cavity itself. It may remain into the inguinal canal or near the deep inguinal ring, or it may come to the base of the scrotum but will not get fixed. So when the baby is crying or straying excessively, the testes will go back up. So these are the different presentation when there is a deficiency of the hormones and if the testes are not completely descended down into the scrotum. These are labeled differently, such as if the testes are not completely descended into the scrotum, either they are into the abdominal cavity or into the inguinal canal, they are labeled as undescended testes. If the testis is coming down to the base of the scrotum, but when the baby is crying or excessively straining, then the testes will go back into the inguinal canal. That is called retractile testes. So before understanding the undescended testes and the treatment symptoms for such babies, you should be knowing the mechanism of the descent of the testes. To know the topic in detail, you can contact our website or you can call the number flashing down below. Thank you.